Hi, my name is Devold Vandermeer, and today a seminar will be done to show you how exercise psychology can aid people with cardiac problems. Cardiac problems affect mainly one group of people within a community or population, with some exceptions. This beholds targeting the more aged within the population, with a few exceptions, with children being born with cardiac diseases or problems, or a few younger people within the population with rare cardiac problems. Cardiac problems include effects such as heart attack or heart failure. Many people do not realize that many different things could be the cause of heart attack or heart failure. Things such as diet, high blood pressure, arteriosclerosis, angina, and the list goes on. Signs of a heart attack or heart failure includes nausea, sweating, shortness of breath, sudden ringing in the ears, and fatigue. Once there has been serious heart attack or heart failure, the patient usually then has to go through a cardiac rehabilitation program to help their heart recover and function as normal as possible. Cardiac rehabilitation can be described as a medically supervised program to help patients with cardiac problems recover from their physical and mental problems following the cardiac incident. The goal of cardiac rehabilitation is to stabilize and to eventually totally prevent or reduce the risk of heart disease, another cardiac event, or fatality. Some different forms of cardiac rehabilitation include counseling to help the patient understand and manage the disease process, designing an exercise program, counseling on nutrition, helping the patient modify risk factors such as high blood pressure, smoking, high blood cholesterol, physical inactivity, obesity and diabetes, providing vocational guidance to enable the patient to return to work, supplying information on physical limitations, lending emotional support, counseling on appropriate use of prescribed medications. The success of these programs, however, always depends on how the patient complies and responds. This success is usually achieved with exercise adherence. Exercise adherence can be defined: the extent to which the exerciser adheres or complies with their exercise or physical program. By understanding which factors affect and control exercise adherence generally helps to better control surrounding and input that affect the patient's adherence. Some primary positive determinants of adherence are components such as the patient's available time, behavioral coping skills, equipment and facilities, group cohesion, the risk of having another cardiac problem, intrinsic motivation, personal perception of good health, and social support. Some negative determinants of exercise adherence are things such as being a blue-collar worker, being overweight, mood state, physical discomfort, being a smoker, and social physique anxiety. Ways of encouraging and creating opportunities for positive determinants of adherence would be to set up a weekly timetable which suits the patient. This would encourage them to follow a schedule and to do activities when it best suits the patient. More government funding and raising awareness about cardiac rehabilitation could help provide more finance for this area of health to provide better facilities and equipment. Also, having facilities and equipment in a more private setting to ensure the patients do not suffer from social physique anxiety or are not embarrassed to participate in their activities. Having sports psychologists or psychologists work hand in hand with patients could help to make the patients not fear the activity but rather enjoy it more, which would increase and reinforce positive intrinsic motivation. Psychologists or medical advisors could also help illustrate to the patient what good health is. Finally, by encouraging a good social network and social support would usually help the patient to adhere to the rehabilitation more regularly and more successfully. Controlling both positive and negative aspects of exercise adherence will greatly aid the patient to rehabilitate and recover from their cardiac dilemma. Goal setting is also a good strategy to increase the chances of the patient's success or completion of the cardiac rehabilitation program. Evidence suggests that a self-set goal is internalized better than an assigned goal. Evidence also, however, suggests that assigned goals are very suitable for progressing through unfamiliar tasks. Since cardiac rehabilitation would be an unfamiliar task for most cardiac patients, assigned goals would be a good place to start setting goals. Although, since self-set goals are internalised better, it might be a better idea to find a compromise between the two methods of setting goals. This could be done by first setting some assigned goals and then getting feedback from the patient, and then letting them have an input in also assigning the goals. This should provide a better chance for the patient to fulfill any goals set. Raising public awareness would be the final step to decrease and help prevent more people of having unnecessary cardiac problems. This could be done through the media, magazines, advertisements and posters. A series of messages will need to be sent out to the public to encourage them to bring a change into their lives with the intention to reduce the number of people that are overweight, obese, or at high risk of cardiac problem. Underlining the reason to change bad health habits will be the first aspect. Discussing what the great benefits you will receive physically and mentally after making a change. This first aspect of the messages will focus on giving attention to the people. Following that is changing the people's attitude and how they view changing their lives. To change their attitude, you once again have to give them the motive as to why they need to make a change. Outlining the benefits and providing a better alternative to their current lifestyle will very often change their attitude to the message. The message will also be focused around taking one step at a time rather than making huge changes, which will most likely give the impression that it's easier, and the individual will feel more stable and confident that they could achieve their goal. This should be one of many strategies that could be used to create public awareness about the cardiac problems that society face. It can be concluded that a number of people in every community faces cardiac problems, and helping them understand how to go through this challenging circumstance is all one can do. Finally, raising